Governor Cooper and Department of Health and Human Services officials were in the East today to mark a year since the expansion of Medicaid and what it has meant for thousands of residents in need of health care.
Amarachi Uche attended the celebration and spoke with the governor as well as doctors about Medicaid expansion. She joins us live in Greenville with more. Amarachi.
Yeah, Courtney, Medicaid expansion is what the governor said is something North Carolina desperately needed. Today, a year into it, he hopes it continues to bring access to thousands of people across the state.
1 year. How time flies.
Governor Roy Cooper, the North Carolina Department of Health and Human Services, and doctors all met at ECU Health Medical Center Wednesday to celebrate 1 year since Medicaid expansion began. This celebration taking on more meaning after a decade of debate and delays leading up to it becoming reality in December 2023.
It's a story that took many twists and turns, but through all of them, we knew that we could never, ever give up.
The Medicaid expansion covers people 19 to 64 years old with incomes that were too high under previous guidelines but too low for private insurance, making health care accessible to more North Carolinians like Darcy Gwill, who went through multiple surgeries after a car accident and was left with an over $4,000 bill and insurance she could not afford.
I am the person that benefited from it, and I am no different than all the other people that could benefit from the expansion of Medicaid.
Back in July, Governor Cooper says 500,000 North Carolinians were enrolled in Medicaid expansion. Now, that number is well on its way to 600,000.
The plan was to get 600,000 enrollees in a 2-year period, and the fact that we're almost there in 1 year shows how great a work that they've done in signing people up and getting the word out.
Helping pay for doctor visits with physicians like Karen Coward at little or no cost to participants, Coward says she's seen improvement in her patients' health as they now have access to care.
And if they're healthy, then the next generation has a better chance of being healthy as well.